Dr. Vaughn, you are really specializing in the blood clots. You know, I've seen video after video, picture after picture of these long white blood clots in autopsy. We've also, you know, throughout COVID, autopsies were really discouraged. We weren't seeking the scientific truth. I see Dr. McCullough, I'll have you kind of answer that, but you know, Dr. Vaughn, first talk about the clotting we saw and what you know in terms of what was discovered under autopsy.
Well, first of all, early in COVID, the spring of 2020, my collaborator, Jacques Lobster in South Africa, was the first one to kind of alert people to say that this was primarily a vascular disease, not a pulmonary disease. And that's one of the reasons that ventilators are probably one of the most ineffective things you could have done to people, because if you have a vascular disease of the lungs, increasing the intrathoracic pressure just closes down more vessels and ultimately kills them. And what we also saw was if you went into the hospital in the spring or summer of 2020, you were twice as likely to leave alive if you were already on a blood thinner. Now, I will tell you, most of your friends that are on blood thinners probably aren't healthier than you, so it's kind of interesting to find out that the people that were on blood thinners had a protection. So again, those were signals that were really downplayed. Unfortunately, after a lot of the treatment was codified by the CARES Act, it resulted in basically a protocol-based treatment for in-hospital care. But what we uniquely found, and my collaborators in South Africa, Risha Pretorius and Doug Kell at University of Liverpool, was that the spike protein was able to induce fibrin from fibrinogen, which is a fancy word for saying, hey, forming the backbone of clotting. But it did it in a way that was different, that we had not seen. And it was what we would similarly think of fibrin as kind of like spaghetti coming out of the colander that you could pull apart when you didn't need it. It was easy to break down. But the actual clot that was formed in COVID or from the spike protein from the vaccine was like burnt spaghetti casserole that you have to get a Brillo pad to get off the dish. And a lot of people, their issue is their inability to break down that clotting mechanism. We all need to clot, but we all need to actually get rid of the clot, and that is the problem.